If you happen to work in aged care or the general practice setting or some other area outside of the hospitals, this standard may not be as applicable to you. However, if you do have to provide any blood products for your patients or residents in any format, you can always refer to the National Safety and Quality Health Service Standards to give you some guidelines around what it means to provide blood to our patients and what was the accountabilities that we have as clinicians. When we think about how blood management fits into our greater clinical standards across healthcare, we need to think about the two foundational standards, as we've talked about in previous presentations, clinical governance and partnering with consumers, as well as the medication standard, because blood we treat as a bit of a medication, even though it's a live tissue. Now, there's some interesting things about blood that you may or may not be aware of. And of course, when we talk about blood, what does that mean? Well, we need to think of that range of different products that we use in our patients in relation to blood transfusions. That might be packed red blood cells, it might be platelets, it might be cryoprecipitate, fresh frozen plasma, factor 8, factor 9, immunoglobulins, and a range of other things that we get from blood transfusions. So every patient is not going to need all of these products, of course, and generally we only try to give the patients the exact parts of the blood that we need to give them. And we do this for a range of reasons. The first is obviously the clinical appropriateness of that. But of course, we also need to think about the cost of blood. Blood is a living tissue. It doesn't have a very long shelf life in a lot of cases. We need to be very sparing in how we use it. And we never know when we're going to need a lot of blood or when we're not going to have the supplies to provide those that we do. So when we think about our clinical governance and quality improvement, how do we actually support blood management in hospitals and healthcare facilities? How do we prescribe and use blood and blood products? And also, how do we manage the availability of blood and blood products? How do we ensure that there's blood available when we need it for our patients? And there's two extra parts that we need to consider when we're thinking about these three main aspects of the blood management standard. And that's the patient blood management itself. What's the clinical appropriateness of our patient? What are the rationale and reasons behind prescribing blood for our patients? But also our accountability and responsibility to the greater community from a stewardship point of view. So there are stewardship statements around blood and how we use blood to make sure that we preserve this precious commodity as much as we possibly can, and we don't give it inappropriately to patients who are perhaps not going to receive the benefit that we might expect from that. So when we think about stakeholders in blood management, well, actually it's all of us, because at some point in our lives, we all might require a blood transfusion because of a disease process, because of trauma, or because of blood loss in theatre, for example, when we're having an operation. So, of course, this standard is very applicable for, of course, our patients and our consumers, but it's also applicable to us as clinicians in terms of how we provide blood, how we use blood, how we care for blood, and how we care for the patient when we're giving them those blood products. And managers, of course, need to know how to help us to do that, to provide the structure and processes that we can use to ensure that we're providing blood safely to our patients. The governing bodies, such as the National Blood Authority, provide us regulations and the ability to understand our responsibilities and obligations in using blood and to ensure that blood is available for the whole of the community when and as they need it. And as I said, it's a living tissue, so there are a range of requirements around storing, distributing, and tracing blood and blood products that we need to consider. If you have a blood fridge in your facility, is it at the correct temperature? And I ask this question rhetorically, but it is something that we need to make sure that we are storing our blood products in the most appropriate way. If I have platelets, for example, platelets, if I left them sitting on the bench, will actually agglutine. They'll form a solid mass, which is what their job is. So before I give my patient my platelets, I need to make sure that platelets are kept and stored properly, and that's usually on a rocker so that they don't clump. And we need to think about that in terms of a clinical applicability. If I gave a patient platelets where some of the platelets were already clumped, obviously there's a number of impacts of that. The patient's not going to receive the clinical benefit. There could be potential additional harm related to introducing clumps into the bloodstream. And so we need to think about all of our blood products and their requirements, because they are quite different across the different types of blood products that we give. And then the final point to think about is the availability of blood. And this is often our biggest challenge in healthcare, providing the right type of blood for the right patients in the right volumes and at the right time. And this can be dependent on a whole range of variables that might be out of our control, including the types of donors donating blood in the first place, the types of blood that other patients are using, the types of situations that we're treating. So when we see multi-traumas, so if we had, for example, a bus or a train crash where we have a number of patients requiring blood at once, that can really drain the national blood stores to a certain extent, particularly on the more rarer types of blood. And so we need to think about, if I have a patient who clinically is requiring blood, is that blood going to be available? And what's going to be the most applicable blood to give to that patient? Alternatively, is there something else that we could use instead? Or could we delay that transfusion, for example, depending on the patient's clinical needs, of course?